Hello everyone, I am Dr. Chinnababu Sunkavalli. Today we are going to talk about how to check patients for oral cancer. What are the tests done to check for oral cancers? So for those with the high risk factors for oral cancer, especially those with tobacco chewing or the other risk factors like alcohol or sharp teeth, HPV infection, they need to undergo some kind of a testing to detect the oral cancer early. So we need to not only look at the correct diagnosis, but also the correct staging is important in order to plan the treatment. So what are the tests evaluation that is being done by a doctor? Usually the number one test is clinical examination by doctor. So we will thoroughly examine the oral cavity, with the help of a torch, and look at the teeth, look at the gums, look at the lips, the cheeks, the lymph nodes in the neck. All this is thoroughly examined not only by inspection but also by palpation. Secondly, endoscopy. Endoscopy is for examining parts of the body, especially which are not seen inside the cavity. They can be checked and back of the tongue or in the oropharynx or in the larynx can be checked with the help of endoscopy. The third one is examination under anesthesia. Sometimes because of severe pain, we will not be able to know the extent of the disease. So we take under anesthesia, especially if the mouth opening is less. We take under anesthesia and examine the entire oral cavity to know if the disease has spread or if the disease is present in different parts and spread to the adjacent organs. The fourth method of checking the patient for oral cancer is by doing a biopsy from any non-healing ulcer that we find. So biopsy is nothing but a tiny part of the lesion is removed, and that is sent for the diagnosis of cancer to be done by the pathologist in the lab. So this is usually done in outpatient department. Sometimes we also do the human papillomavirus testing. That is basically again to know for the risk for the oropharyngeal cancer. So in some other patients, we also do the CT scan or MRI to know the extent of the disease, wherein the staging also is very much possible, and this helps in delineating the extent, especially in tongue cancers. The MRI is very, very useful. So these are the simple tests that are done to evaluate or to check the oral cancer and how they have spread to other parts. So basic tests, simple examination, and the simple tools to evaluate the disease or the extent of the disease. Thank you so much for watching this video.